All right. Thanks for listening. My name is Keon Brown. I'm the brand elevator. It's my pleasure to continue our series on careers in partnership with the Montclair alumni of Kappa Alpha Psi Fraternity Incorporated and our Kappa League, trying to expose our young folks to as many types of careers as possible. Today, we have a good friend of mine, Jeremy Coy. He's a CRNA, MSN certified registered nurse, anesthesiologist, also called a anesthetist. Uh, what's up,
hmm
Jeremy? How are you?
I'm well. How are you?
I'm good. I'm glad to have you here, and I don't know anything about what you do. I know that I've had my teeth pulled before, and I know that they had to put me under anesthesia, and so that's
Yep.
what I think you do. You kill people and bring them to life.
Yeah,
So
in a layman's term, yeah, that's exactly what we do.
so yeah, talk to me. Introduce yourself better than I could do, and kind of talk about what you do, where you went to school, and kind of what you do every day.
Um, okay, yeah. Like you said, my name is Jeremy Coy. My actual initials and credentials are CRNA. They're classically known as Certified Registered Nurse Anesthetist. We're moving more towards the nurse anesthesiologist moniker. Um, our physician counterparts have started calling themselves physician anesthesiologists. And as you are probably aware, ologist as the suffix of a name is one who studies or has knowledge in a specific science, and that's where the term anesthesiologist comes from. That's why we're moving more towards the nurse anesthesiologist. Um, that's just a clarification of the name. But yeah, what you said basically is a roundabout way of saying it. We essentially, and pardon the lack of better terms, we essentially poison the body and the brain specifically to the point of death. Keep the body alive while we perform the procedure that we need. And then we reverse the poison and bring the body and the brain back to um, life and consciousness. The term anesthesia is basically defined by rendering the body insensible to pain and insensible to consciousness. So there are many forms of anesthesia, as you can imagine, um, and that's basically what we do. We do surgeries, um, we do procedures, not necessarily classified as surgeries. We do sedation for non-invasive type procedures. Um, I don't know. Ask me questions. It's easier for me to answer questions than it
For
is.
sure. For sure, absolutely. So a lot of our kids, or several of our kids have spoke of anesthesiast or anesthesiologist or this industry as something they're interested in pursuing. What kind of credentials are required for one to go into this particular track?
Okay. So for me, as an example, my background is in nursing. There is another path of anesthesia where your background is in medicine, and I'll walk through the differences. One of the big, I'll just start off with this. Um, I greatly appreciate hearing that there are a generation of young individuals that are looking to get into the profession, whether it's mm, physician anesthesiologist or nurse anesthesiologist. The country is in a shortage, and we could use many more. That being said, I'm obviously partial to the nurse anesthesiology field. Um, so for me, after you and I walked the stage at Hoggard back in, ready for it, 2001, crazy to think about. When
Yep.
we left Hoggard, I took off and I went to college for nursing. Um, I finished college, got my bachelor's degree in nursing, immediately got an ICU nursing job which is part of the requirement for anesthesia. And 3 years later, I applied and got accepted to the nurse anesthesia program at ECU. Went on to that. That was a 28-month program, and graduated with my master's of science in nursing. Currently, the mandate is a 3.5 year graduate level, which you will come out with what's called a practice doctorate, which is the Doctor of Nursing Anesthesia Practice. That is the newer degree associated with the CRNA credentials. So if you map it out from beginning, undergrad, bachelor's degree, that's 4 years. You have to have at least 1 year of ICU experience. Most people are preferring 2 to 3, but 1 is required. And then you do a 3 to 4 year doctorate, like bachelor's to doctor program, but it's not a PhD, it's not a research doctorate, it's a practice doctorate. You can get your PhD just like any other profession, but the actual requirements now are going to be basically by next year, all graduating anesthetists, anesthesiologists from programs are going to have a doctorate. That's
Now,
a
I want to say real
long-winded.
quick.
Yeah.
Well, it's cool. I love it. It's very clear. I love that. Appreciate that. Now, when you graduated from these programs now, because you're bringing people back to life now, did you graduate, cum, magna, summa, or thank you, laude?
It was more. I was a thank you, Lottie, definitely. I was nowhere near. I was near. I was probably second or third in my class in anesthesia, but
Awesome.
we don't. When you get to the to the graduate levels, they don't give you all the recognition. Because the thing is I was in my program, right? My program for anesthesia had 12 people. I was probably the second or third in my class, but we still graduated with hundreds of thousands even of other master's level nurses. So no, I was nowhere near the top of that, just because there were so many. And I'm not, this isn't knocking any other master's level nurse, but the requirements for anesthesia are so stringent that they're so difficult. It's just hard to be that high up when you compare it to some of the other master's degree in the nursing medical profession. Does that make sense?
Oh, absolutely. Absolutely.
Okay.
What
Good.
are some of the interests that you have to have? Like, is this heavy in math and science? Is this heavy in customer service and compassion? Like, what is it that you found yourself, equipping yourself with?
Well, I would say any profession, you better serve yourself by being more in the compassion, personal, humanitarian aspect. That's just me. I mean, you know me, you know my parents. That was me. That was how I was raised. I feel more that way, and I feel like nursing background trains you to be a little bit more compassionate. I mean, we deal with a very scary time for people. Unless you work in an operating room or unless you work in anesthesia, one of the biggest concerns for people is what anesthesia is, what they're going to do to my body while I'm asleep, how bad is it going to hurt when I wake up. We deal with a very acutely ill person that's scared out of their mind. And I feel like one of the parts of my job that I cherish more than anything is in a hospital setting, in a fast-paced environment where you're going from case to case to case. I get a window of about 3 to 10 minutes with each patient, and they have to trust me with their whole life for the remaining moment that they're in that procedure. So I have to get them on my side. I have to talk to them. I have to be able to hang out with these people and get them to wholeheartedly trust me. If not, I'm not starting my job off right. I may get you through it and wake you up, but if you're freaking out because I didn't do my introduction well enough, then that's just going to set the whole thing off for a little bit less success, if that makes sense. Um,
For sure.
so I cherish that part of the job. That being said, the education and the requirements are very heavy in math, biology, chemistry. Um, we are kind of a mixture between biologist, chemist. We're doing mathematical calculations for drugs and patient weights and things like that on a minute by minute, hourly basis. I get asked uh, probably no less than 3 to 5 times a day from various people what's the max dose of this that this patient can get, and I have to be able to calculate that. There's that kind of thing, but again, experience and training is what allows you to do that. So I hope that answers
I'm
your
looking
question.
at absolutely, absolutely. According to Data USA, as of I think this is 2017, um, 2016 rather, yearly wage is 148,349. Um, yeah, it says
Yeah.
in 2016, nurse anesthetists earned an average of 148,349. Um,
The new statistics have come out. We track that. Our National Professional Association tracks that yearly. The most recent ones came out. The average is now about 168.
okay.
It's gone up pretty significantly. Again, that goes back to what I said previously, that there's a fairly large shortage. Um, we are in high demand. You can't do surgery without anesthesia, and hospitals don't make any money unless they do surgery. So without one, you can't have the other. Um, but yeah, I mean, I would say um, average. The most recent statistic that I read, average was about 168 to 169 for the country. Now, it's hard to explain, but in anesthesia, we're very regionally, very geographically dependent. Like if you go to a small rural hospital in Montana, you're going to make 300, 280, 300 because there's nobody else around to do this. You work in a big major teaching institution where there's hundreds of anesthesia providers, your salary may be in that 150 to 160 range. Um, I am something in between where I am. I work at a small community hospital, but I'm in a well-populated area. There's plenty of we live at and I live at the coast. A lot of people want to be here. Um, that being said, the competition is still not overboard, but I think at my current job, I think I'm averaging probably 230 to 250. I would say a reasonable anesthesia salary. That's kind
Excellent.
of yeah.
So in addition to salary, we want to go into gender comparisons. As 59.9% of nurse anesthetists are female, making them the more common gender in the occupation. It looks like male is just around 40%.
Mhm.
60-40, it's like 60-40 basically. Um, and as far as race, it says 87% of nurse anesthetists are white, making that the most common race or ethnicity in the occupation, representing 7% of nurse anesthetists. Black or African Americans are second most common in there, and it looks like this is around a little bit less than 20%.
Mhm.
Actually, 7,
That
as
sounds
I
about
said
right.
before, 87 is white. Okay. And then you have Asian, less than 7%. Less
Yeah.
than
Well,
7%.
right. I mean, there's a huge push right now for diversity. So
Mhm.
the I can address the male female ratio, right? And if you're looking at nursing and nursing anesthesia, nursing has been dominated for decades, even centuries, by females. It's just traditionally a female role. that has evolved into a profession and a career, and now the stigma, so to speak, with nursing has moved away from a female subordinate type of position
Mm.
to, subordinate to a physician to a more frontline profession. So if you look at the profession of nursing and you take the specific specialties of nursing, it's still female dominated, and therefore it stands to reason that the profession of nurse anesthesia would still be female dominated. Now that 60-40 has narrowed significantly. It used to be like 80-20, and then it went 70-30, and now it's 60-40. It may even be coming down further. But the one caveat to that is if you look at men in nursing, and I'm not even familiar with the statistic, but I'd be curious to know how many men in nursing go the anesthesia route. Like I think the overwhelming percentage of male nurses go into anesthesia where maybe not the case in female. Do you see what I'm saying?
Yeah,
I think
absolutely.
that
I'm
plays into the statistic. Um, the the racial and ethnic gap, there's actually a very big push. Like minority students could probably very closely maybe get education for free at this point. There's a huge push to increase diversity in the field of nursing anesthesia. Um, there's a whole committee with our national association devoted to it. They spotlight minority students in the anesthesia profession like monthly, especially the ones that are currently in training. Um, yeah, I mean, that gap is going to get narrower and narrower over the next decade or so. And I look
I'm
forward
super
to it,
interested in
to be honest
Jeremy.
with you.
Yeah, I'm actually really interested in this. Has opened up my mind quite a bit. Um, and the customer service, the compassion, the kind of people kind of space is kind of my space. So if I could just learn the
Hmm.
bio or the calculation piece, that's not my strength. Um,
Hmm.
it's just very intriguing to me that this is kind of what you do. I'm interested in um, I'm interested in the day to day, the day to day. And I can't remember. I remember him having like propofol or like some white substance or whatever. Like I remember that. I don't remember what he did to me or when it was applied. But what is your day to day? What do you do when you wake up, get to office, get to the hospital or wherever you work? Like what is your day to day?
um, okay, so um, I I start my day like anybody else in any working career. You get up, you make a cup of coffee, you kiss your wife and kids and say, have a good day. I'll see you when I get home from work. It's not like some superhero walking out with a cape getting ready to save some lives. Like that's not how it's not how we look at it. Though by the end of the day, you've probably saved a couple lives. And that's what's rewarding about the profession. Um
Hmm.
um Day to day, I would say I get to the hospital about 6:30 in the morning. Um you get a room assignment. Basically you walk in, you already kind of have your idea. You look at the schedule for the day. I'll give you an idea of where I am specifically. We have 4 OR rooms, we have a procedure room, and then we have 2 OB rooms. The OB rooms are specific to C-sections. The 4 OR rooms are general surgeries. And then we have a procedure room where we do things like maybe like a bronchoscopy or a cystoscopy or something that doesn't necessarily classify as a full-blown sterile technique surgery. We call that a procedure room. So you get your room assignment, you go in, you get your patient list, and you know what you're going to do. And you look at the procedure, you look at the patient's chart, and you look at what is required for the surgery, which, again, that goes back to our training, and you formulate an anesthetic plan for that specific patient. So I may do one patient in a day, I may do 20 in a day. Each patient has their own anesthetic plan. I may put them to sleep. I may sedate them with a little bit of local anesthetic to numb the area that's being worked on. I may do a block where, say you're having surgery on your arm, I can numb the nerves to your arm, and you'll never know that anything's happening. And then 12 hours or so later, you regain full full feeling and full function back in your arm. And that time is dependent on which drug we choose to use and how long the procedure is and that kind of thing. Um,
Wow.
Basically, day to day, at any given time, you're on call. We always respond to emergencies. We are considered the quote unquote airway experts. Um, I get called to the emergency room, to the ICU, to code situations all the time to secure an airway, because basically we are so good at it because this is what we do all the time. Um, we get we get brought into the not so ideal situations, if you know what I mean. Um, and that's kind of, and then, you know, come time to leave, if you're on a shift, cool. If you're on call and you're just there until the cases are done, you leave, you go home, sit back, put your feet up, hang out with the family, cook dinner, go and go on about your business for the next day. Um, you know,
Thank you for that. That
yeah,
illuminates a lot for me, and I know whoever's listening is opening up. Like, this
good,
gives a kind of bird's
good.
eye view of what they could expect.
Mhm.
Um, I see a cool piece of information also from Data USA. Just a couple other areas, like you work in a regional kind of small hospital. It also says nurse anesthetists are also found also in hospitals, a larger percent of 64% in hospitals, other physicians' offices, office of health practitioners, outpatient care centers,
Mhm.
and other health
Mhm.
care services. Can you elaborate on some of those kind of other places where you could potentially be as a nurse anesthetist or a
Yeah.
anesthesiologist as they're moving to? Yeah.
Well, ironically, my wife is also a nurse anesthesiologist. She
Oh
works
wow,
and
Sonny. Okay.
practices. Yeah. so so we both do the same thing. She actually works in an outpatient setting. She is a contract employee. So what I can do is take this opportunity to misspell any misconceptions about the profession. No, we don't work for anesthesiologists. We're not a physician's assistant of any form. We operate under our own licensure. We operate in collaboration with other physicians. We don't operate under the direction or any direct, direction by a physician. When we say in collaboration, we don't provide anesthesia services unless you're having a procedure done that requires it. Does that make sense?
Yeah.
So,
So you're
um, you
independent
know,
and you evaluate because you create a plan for this person already during the day, and you're
hmm
not no one's telling you what to apply. You are making your determination based on what you see, and then in collaboration with whomever else is working on the patient.
correct. Um,
Okay.
each individual location has their own practice model. So there is a fully independent practice model. That's what my wife does. She goes into work. She is the sole anesthesia provider. She works at a GI clinic, and she also works at a plastic surgeon's office. Um,
Wow.
she works for herself with that surgeon or that doctor that she's with that day. So the GI clinic is associated with a handful of different doctors. she doesn't know from day to day which doctor she's going to go in and work with, and they don't know. Um, well, they probably know that she's the one there, but they don't have any jurisdiction over what it is that she does. Their goal is to get the procedure done. Her goal is to give the anesthesia for the procedure. So they don't cross paths in direction at all. Um, the other thing that there is a model, it's called the ACT model, and the ACT is ACT, Anesthesia Care Team. That, in a roundabout way, is the model that I work in the hospital that I work in. Now, there are hospitals out there that are very much CRNA only, independent practices. What I work in concert with, in collaboration with anesthesiologists. There's one anesthesiologist there every day, and there's 5 nurse anesthetists or nurse anesthesiologists. So you'll get one physician and 5 nurses. That's a care team model. Basically, you have the anesthesiologist walking around, checking on everybody, making sure patients' charts are right, making sure consents are signed, making sure there's nothing funky going on, and you have the nurse anesthetist in the rooms providing the anesthesia. Um, in other hospitals, there may be one nurse anesthetist that's walking around, seeing the patients, bringing them back into the room, doing the procedure, going to the next one, and then going to the next one. Um, we provide a range of services, including to patients in the PACU, the immediate recovery period of anesthesia. Um, we provide pain control. We call it the perioperative period. So you'll come in, day of surgery, have your pre-op assessment done, have your procedure, go to the recovery room, and then after a certain amount of time and you meet certain criteria, we send you home. That period is the perioperative period. Anesthesia has, for lack of better words, anesthesia has control of that perioperative period. When you go home, your doctor or your surgeon gives you pain medicine to go home with. We provide the pain medicine and we treat you while you're in the hospital. You see the difference?
Got it. Yes, definitely.
Yeah. So there's various different things. A lot of anesthesia is provided in hospitals and in ORs. There is a growing want and need for what we call ambulatory surgery centers, where you come in, you have a minor procedure, you get anesthesia, you get recovered, and then you get sent home. It is an ambulatory surgery center. Um, we so we provide anesthesia, everything from a GI clinic where you're getting sedation for a quick little surgery, a little procedure. You get sent home, and then you move up into like what we call office-based practice, where like my wife works at a plastic surgeon's. You're having surgery, but you're having it at the doctor's office. Plastic
Hmm.
surgeons are notorious for this. Dentists are notorious for this. Um, dermatologist may employ an anesthetist to do different type of superficial um, type procedures. And then you move up to the ambulatory surgery center, and then you move up to the big, large tertiary hospitals doing the big cases. And that's what I used to do before my current job. Um, so I don't know. Did that answer your question?
Yeah, absolutely. Absolutely. This has been most
Good.
informative. Uh, Thank you. I mean, the last thing I'm going to say before I give you the final word, a couple more things, but a couple things that I'm seeing as far as skills are concerned. I know we talked about kind of compassion and things of that nature, but I'm going to read off a couple things, and I wanted to kind of get your, maybe what sticks out to you. Let me see. Judgment and decision making, quality control analysis, troubleshooting, equipment maintenance, uh, service orientation, negotiation, persuasion, coordination, social perceptiveness, management of personal resources, monitoring, complex problem solving, time management, um, What do you think so far?
Every single one of them.
Okay. Anything that stands out to you, or anything that may be left out?
Um, I think you said it in a different way, but I would say critical thinking and analysis. I think you might have already said that in a different terminology, but um, we in anesthesia, and it's just the nature of the beast. It's the kind of person you have to be. You're in the room. You're the one in control of that patient. And I don't mean this in a bad way, but the physician, the surgeon. So if you just take a basic surgery, like we'll say, for example, a gallbladder. You go see a surgeon. Your stomach's bothering you. You got some pain. You can't eat right. Something's going on. The surgeon looks at you, sees you in the office, does some lab work, um, does a couple of diagnostic scans, and says, yes, your problem is your gallbladder's not working right. We need to take it out. That's where all your problems are coming from. Okay, cool. You go to the desk, you schedule your surgery, you come into the hospital. Well, bam. Now you talk to anesthesia. My goal is to find out everything there is about you so I can formulate the best plan for you, and I know what risk I'm going to encounter, and I know what my goal for you coming out of surgery is. The surgeon's goal in that situation, they may not even know that you ever had a heart attack 3 years ago. Their goal is to
Yikes.
get that gallbladder out and get you feeling well. My goal is to find out how to do that the easiest and safest way possible. So in the room, I am in control, so to speak. Um, if I tell the surgeon to stop operating, he stops operating. If I tell him or her to start operating again, they start. If I tell them to just keep going, I will figure this problem out. They know that they're on alert, but they're going to keep moving forward with the procedure. Um, with that said, you have to have an interpersonal and a collegial relationship with the other people in the room, because you're in control, but you're in control for that patient, not for your own ego. Does that make sense?
Hmm. Absolutely.
So, yeah, so I mean, that's why everything that you listed off there makes sense to me in the profession. I have to be able to do quick decision making on the drop of a dime, seconds count. I'm making split second decisions. I make quick split second calculations. I make a decision to, as an example of what I just said, I tell the surgeon, keep moving forward with the procedure. I'm figuring something out. Well, there could have been a situation where I should have told that surgeon to stop immediately and prevented something bad from happening. So you have to be able to make that decision. You can't, if you start going, sir, ma'am, don't, hold on, don't, they don't know how to react to that. Their goal is to get
Sure.
in, get the surgery done, and get done. Mine is to get the patient through the procedure. And as you said way back at the beginning of this conversation, I basically kill somebody and bring them back to life. So my goal is to take a calculated judgment on what it is that I'm going to do for you to basically poison you to death, bring you back to life, and you wake up and feel completely normal the next day. You know what I mean?
Wow. Yeah.
And that in a nutshell is what we do in anesthesia, and it's challenging. It's it's not always easy. I had a really bad situation a couple weeks ago at work. Hit me close to home, with a 9-month-old patient. Not my patient, but somebody that I went to assist with. But again, it wasn't my patient, but I took it to heart. I have a 1.5 and a 4-year-old at home. A 9-month-old hits pretty close to home when things don't go well. You know what I mean? So, um, it's not always easy. It's not always rewarding. Some days can be challenging. But it is 100% a rewarding profession that you will walk away with knowing that you're doing something respectful, you're doing something good for society, you're contributing to your family by making a good income and providing things that even, you and me didn't have growing up. Like just constantly, I don't know, like having job security. When the recession hit back in 2008, 2007, 2008, I was lucky enough to have chosen a profession that was recession proof. If anything, I saw my need go up. Where people were getting laid off, I was being recruited. Um, that's another positive about the medical field and a specialty that's needed. Um, you know, there's like little things like that that go into it. I'm not going to sit here and blow smoke and say every day I walk home and I'm just happy and chipper and yay, go me. Like it's not going to be like that every day, but you know, overall, I definitely made the right career choice going this way for sure.
Well, excellent. Well, I want to say before I give you the last word, Jeremy, thank you for um, just taking this time out during your day of killing folk and bringing them back to life to share what you do and really really baseline what it is that you do and what's required to be successful in this profession. I think my eyes are completely open. And I know that people who are listening to this are going to be able to make decisions and put this in their on their list of things to discover as recession proof and something that's going to be solid and that's always going to be in high demand. And that when we're looking for more minorities in the field, I think those are such a ripe profession for growth. And the stats don't lie. I'm looking at these stats right now, and there's going to be significant growth in this industry in the coming years.
Oh
And
yeah,
so,
of
thank
course.
you, thank you for like just taking the time and being available for this. I'll give you the last word if you want to make any acknowledgments and anything that you want to add as we close.
Um, well, I just want to say you're welcome. It's my pleasure. On a personal basis, for you, I'd do anything I can to do something for you and help you and your goals. I'm glad that
Thank you.
I'm glad you wanted to spotlight this profession. I'm glad to hear that there's people that young people that are interested in the profession. Um, I would love to see more and more people going into it. We used to have this saying that we were the best kept secret in medicine. Well, it's proven here lately that we kind of self detriment that whole best kept secret. Nobody knew what we did. Nobody knew what we were. Nobody knew that he even existed. And now we're trying to change that because we have this whole generation of baby boomers that are retiring. We have this whole generation coming up through school that are looking at career paths. And, you know, it, we need to ensure that we have healthcare workers of any form for the future generations. I mean, it's not going to be long, Keon. I hate to tell you, man, before you and I are going to start needing some of these people, and we're going to want to know that we did our part in upcoming generations to help, secure our future. So the profession is a great one. Um, I trained alongside a lot of really good nurses, a lot of really good physicians. Um, we do the same thing. The only difference is a nursing background versus a medical school background. Um, one thing that nursing anesthesia touts is it's significantly less expensive to go to a nursing route than it is the medicine route. I don't really know why that is, but it is. It's significantly cheaper. Um, I'm trying to think what else I can say about it. Um, it's been a great profession for me. I trust that it's going to continue to be a great profession. You gotta stay diligent. You gotta continue to educate yourself. When you start thinking you know everything when it comes to the human body, you get yourself into trouble, get your patients into trouble. So nothing about it is easy, but everything about it is worth it, if that makes any sense. And
Absolutely.
I don't know what else to say. I mean, if I'd be glad I'd be glad to answer any questions. I'd be glad to talk to anybody if they want to personally talk to me. Feel free to send them my way. Um, I'm glad I could do this and help you out.
Thank you, Jeremy Coy, CRNA and an MS in certified registered nurse and anesthesiologist, anesthetist, all of that. Thank you for sharing and being a part of this. If you want to hear more, go to thebrandelevator.com and always hashtag the brand elevator. We're standing for you. You can achieve anything. Thank you, Jeremy.
All right, thank you.